Did you know that your skin, nails, and even your breath can give you important clues about the health of your kidneys? Kidney disease is something that I see and treat every day. It's more common than you think, and it's often hiding in plain sight. In fact, it's estimated that up to 90% of people with chronic kidney disease don't even know they have it. This is a major problem because if we can catch kidney disease early, we can usually treat the root cause and prevent further damage. So today I'm going to show you the top 17 signs of chronic kidney disease, which may just save your kidneys and your life. These two bean-shaped organs sit on either side of your lower back, just under your ribs. Now, most people think of kidneys as filters, and it's true. They filter out toxins and get rid of them in your urine, but they do so much more than that. They help regulate levels of salt, potassium, and other electrolytes. They balance the acid levels in your blood. They even control your hemoglobin levels and help maintain your bone health. So the question is, how would you know if these delicate, sophisticated organs were in trouble? Let's start with foamy urine. And I don't mean a few bubbles that disappear within seconds. I'm talking about a true layer of dense white foam that sticks around, similar to what you might see on top of a beer. This is a sign that a protein from your blood, called albumin, is leaking into your urine. And to understand how it gets through and what it means for your kidneys, let's take a closer look. This is a glomerulus, just one of about 1 million tiny filters that make up each of your kidney. It's a tiny bundle of blood vessels, so narrow that red blood cells have to squeeze through single file, but we need to look even closer. Now you can see what looks like tiny little hairs all over the surface of the blood vessel. These are actually tiny tentacles that extend from specialized cells called podocytes, and they create a living filter. But when podocytes flatten, that leads to gaps opening in the filter, allowing proteins like albumin to leak out, and that could easily go unnoticed. But luckily, albumin has a structure kind of like soap, which is why it creates this thick foam. Actually, this is a bottle of albumin that we use in the hospital, and you can really see how foamy it gets. Okay, now let's do a quick test together. This is something I do on almost all of my patients in the hospital. Roll up your pant leg and then gently press your thumb into the lower shin bone for about 5 seconds. Then check to see if it left an indent. If it did, it's called pitting edema. The reason this happens is related to the frothy urine. As you pee out albumin, you end up with lower levels of albumin in your blood. And albumin plays an important role in holding fluid inside your blood vessels through osmosis. So without enough albumin, fluid starts leaking out into your tissues, causing swelling. This free fluid tends to follow gravity, which is why most people notice swelling in their legs and feet, although it can also end up in loose tissue, like around your eyes. But here's the problem: even though you're swollen, you actually have less fluid circulating inside your blood vessels, and your kidneys assume that means you're dehydrated. So to try and help, your kidneys retain salt and water, which just makes the swelling worse. And that's a vicious cycle. In severe cases, that fluid can even leak out into the lungs, making it difficult to breathe. But before you panic, there are a lot of causes of leg swelling. A small amount can even be normal after standing all day, but that should usually get better overnight when you're lying down. If your leg swelling doesn't get better or becomes more pronounced around your eyes, then it could be related to your kidneys, and you should get that checked out. Alright, now on to a common myth. I find that most people think that if you're peeing a lot, then your kidneys must be healthy and doing well. But when it comes to your kidneys, quality matters more than quantity. In fact, the first thing to go when your kidneys are struggling is the ability to concentrate urine, and this is most noticeable at night. Normally, your kidneys make concentrated urine overnight, partly because you're not eating and drinking, but also because of a hormone called ADH. So if you're forced to get up to go to the washroom multiple times at night, we call that nocturia. Then it could be one of the first signs of kidney disease. Okay, now take a look at your nails, especially the color of them. It's normal to see two colors, particularly on the thumb. The lighter part at the base of your nail is called the lunula, which just means little moon, and you can think of it as nail that's still under construction. Now compare that with the nails of a patient with chronic kidney disease. They also have two different colors, but don't be fooled, that's not a normal lunula. The other half of the nail has a reddish-brown color. These are called half and half nails. Not everyone with chronic kidney disease will have nails like this, and we actually don't know exactly why it happens, but there is a strong association between those nails and kidney disease. Now let's switch our focus to phosphate, a mineral that your body tightly regulates and that causes major issues when levels start to rise. We primarily get phosphate from our food. In fact, most of us consume too much phosphate in our diets, but healthy kidneys can easily handle that. Although when your kidneys become damaged, they can no longer get rid of excess phosphate, and so levels start to rise in your blood. The reason this matters so much is because phosphate binds to calcium, forming calcium phosphate crystals. Depending on where they deposit in the body, these crystals can cause a wide range of symptoms. When they deposit into the skin, it's called calcinosis cutis. It usually appears as whitish-yellow bumps that are hard under the skin and typically painless. Sometimes they can break open, releasing a thick paste of calcium phosphate that resembles toothpaste. Aside from kidney disease, this condition can also occur in autoimmune diseases like scleroderma or dermatomyositis. So as a rheumatologist, I see this quite often. While these skin deposits can be distressing for patients, they are in some ways the best-case scenario, because those same calcium phosphate crystals can also deposit inside blood vessels. That can lead to a life-threatening medical emergency called calciphylaxis. In such cases, blood vessels become blocked, tissues and organs are deprived of oxygen, and in severe cases, it can be fatal. But there's an even more subtle way that high phosphate levels can affect your blood vessel. Take a look at this X-ray. Yes, I know he's missing part of his finger. We'll leave that to ortho. What I want to draw your attention to are the arteries. You are not supposed to be able to see them so clearly on an X-ray. So what's going on? Normally, your arteries contain smooth muscle cells that constrict and relax to regulate blood flow and pressure. But when exposed to high phosphate, these cells undergo an identity crisis. They begin behaving like bone cells, laying down calcium phosphate into the walls of the artery. As a result, the artery walls, which are supposed to be flexible, become hard as bone. You can actually feel this hardening under the skin, and the best way I can describe it is that it feels like a guitar string underneath the skin. Clearly, high phosphate levels are a major issue. One of the ways your body tries to manage them is through a hormone called FGF200. This hormone signals your kidneys to excrete phosphate in the urine, and it also tells your intestines to reduce absorption of phosphate and calcium. It does this by blocking the conversion of vitamin D into its active form. Eventually, this leads to dropping calcium levels, which can cause excruciating muscle cramps, especially at night, when you're trying to fall asleep. Although low calcium isn't the only culprit. Early in kidney disease, you can also have low magnesium or too much acidity in the blood, a condition called acidosis, all of which can lead to muscle cramps. So if you're experiencing unexplained muscle cramps and haven't just started a new exercise routine, it's worth getting your kidney function and electrolyte levels checked. Now let's shift our focus back to calcium. When calcium levels drop, your body releases parathyroid hormone, which tells your cells to start breaking down bone to release calcium into the bloodstream. It's a helpful short-term fix, but over time, you're really just trading one problem for another. This leads to weak, brittle bones that are prone to breaking, a condition called osteoporosis. One important sign of osteoporosis that I look for is height loss. So it's a red flag when a patient tells me they're a few inches shorter than they used to be. Of course, breaking a bone after falling from a standing height is another clear indicator, especially fractures of the wrist, spine, or hips. But beyond electrolytes, there's a whole mix of toxins that build up in the blood when the kidneys start to fail. We call this uremia, which is a gentler way of saying urine in the blood. The earliest symptoms can significantly affect your sleep. A relentless whole-body itch, often worse at night, can sometimes be the first sign of kidney disease. That's exactly what happened to a 57-year-old man who went to the doctor after scratching his skin raw. Blood work revealed he had advanced kidney disease. Several factors can contribute to this. Uremic toxins can accumulate in the skin and cause irritation, and they can also activate an itch receptor called PAR2, which makes nerve endings hypersensitive. Even worse, these toxins can eventually reach the brain and chronically stimulate your itch circuits, leaving you feeling constantly itchy. Restless leg syndrome is a horribly annoying condition that causes an overwhelming urge to move your legs, usually at its worst when you're lying still at night, trying to fall asleep. The leading theory is that when your brain is low on iron, it can't produce enough dopamine, which triggers this irresistible urge to move. But what does this have to do with your kidneys? Well, uremic toxins drive inflammation, which leads to the production of a hormone called hepcidin. Hepcidin is designed to protect your body from bacteria, which thrive on consuming iron. Here's how it works. During an infection, hepcidin pulls iron out of circulation and stores it away, while also preventing additional iron from being absorbed through the digestive tract. This strategy helps starve bacteria of iron, while your immune system works to eliminate them. But here's the problem. When kidney function declines and toxins accumulate, hepcidin levels rise inappropriately. So even when there's no infection, your body ends up chronically starved of iron, and that's what contributes to restless leg syndrome. The takeaway is that if you're having trouble sleeping, especially due to an urge to move your legs, it's worth checking your kidney function. As uremic toxins continue to build up, they can also begin to affect your taste and appetite. Imagine you're about to bite into your favorite treat, and it suddenly tastes like metal, almost like licking a penny for those who remember what that's like. We actually don't have pennies in Canada anymore. A metallic taste is a very common complaint in kidney disease. When urea builds up in your blood, some of it enters your saliva. There, your normal oral bacteria break the urea down into ammonia and other compounds. These byproducts stimulate specific receptors on your tongue, which most people experience as a metallic taste. Unfortunately, these compounds can also make your breath smell a bit like urine, a condition we call uremic fetor. So when your breath smells like urine and your food tastes like pennies, it's no surprise that many people with kidney disease lose their appetite. But believe it or not, it gets worse. Uremic toxins directly affect the brain by activating receptors that are normally used to detect food poisoning. This area is known as the chemoreceptor trigger zone, CTZ. It doesn't have a blood-brain barrier, which means it can quickly and accurately detect toxins in the blood. When it senses a harmful substance, it tells your body to stop eating and to vomit as a protective response. While this is a useful defense mechanism in the case of actual poisoning, it becomes a serious problem in kidney disease. Uremic toxins can trigger this sensor even when there's no actual danger, leading to a persistent loss of appetite, nausea, vomiting, and over time, unintentional weight loss. Next up is easy bruising. My husband Mark is constantly banging his knee against the corner of our bed frame, and most of the time he barely even gets a bruise. But patients with kidney disease often develop massive bruises without even knowing how they got them. Normally, when you get a cut or injury, tiny blood cells called platelets rush to the damaged blood vessel and clump together to form a plug, your body's natural band-aid. However, In kidney disease, uremic toxins make your platelets less sticky, so it becomes harder to stop bleeding. Some early signs of this include bleeding gums when brushing your teeth, more frequent nosebleeds, or unexplained bruises on your skin. Now take a look at this 39-year-old man with kidney failure who missed a few of his dialysis sessions. His skin is covered in a fine white powder. This is a late-stage finding known as uremic frost. Essentially, his sweat is so concentrated with urea and other toxins that when it dried, it left behind a layer of fine white crystallized residue on his skin. This is rare to see, and if you do, it's a sign of advanced kidney failure. There's another interesting late finding of uremia that I wanted to highlight. Uremic toxins can cause chronic inflammation of the pericardium, which is a thin sac that surrounds the heart. When it gets inflamed, we call it pericarditis. But unlike having an inflamed knee, you can't just rest your heart until it feels better. The heart keeps beating and rubbing against this inflamed tissue, which causes quite a lot of pain. And when I listen with my stethoscope, I can hear a scratchy sound like this. That's wild. It's actually the sound of the inflamed tissue moving as the heart's beating. Okay? Getting back to common symptoms. I think the one patients tell me about the most is fatigue. There are many things we've already talked about that can contribute to feeling tired when you have chronic kidney disease. Poor sleep from muscle cramps, itchy skin and restless leg syndrome, changes in your electrolytes, and uremic toxin buildup. But there's another important cause that's not too difficult to treat. Your kidneys are responsible for producing a hormone called erythropoietin, which tells your bone marrow to make more red blood cells. Yep, that's the same EPO that Lance Armstrong admitted to using to raise his red blood cells and boost his performance. If high levels of EPO can help you win the Tour de France, then low levels in chronic kidney disease can make climbing a flight of stairs feel impossible. But thanks to injectable synthetic EPO, we can actually reverse a lot of the anemia that comes with chronic kidney disease. And the last sign to mention is having no symptoms at all. Chronic kidney disease is classified into 5 stages, with stage 1 being the mildest and stage 5 the most severe, often the point at which dialysis begins. The truth is, many people won't notice any symptoms until they have already reached stage 3. If kidney disease is detected earlier, it's usually found incidentally through blood work or urine testing. That's why prevention is key. There are many reasons kidneys can get into trouble. For example, in this video, I discuss a real case where a pretty common snack resulted in serious kidney damage. But by far the most common culprits are diabetes and high blood pressure, 2 conditions that we can often prevent and treat effectively. Another cause I'm seeing more frequently is the overuse of medications like ibuprofen and naproxen, which are so easy to pick up over the counter at the pharmacy. I think people often underestimate the risks of chronic use of these medications, not just for the kidneys, but also for the stomach and heart. So, I recommend using them sparingly. And if you are using them consistently, talk to your doctor about checking your kidney function. Hopefully this video has helped you appreciate how amazing your kidneys are and why it's so important to keep them healthy. If you're feeling motivated, I'd recommend watching this next video where I go over evidence-based strategies to lower your blood pressure naturally without medication. As always, stay curious and stay healthy.